This video is going to talk about root canals. Specifically, when we're talking about a patient who has an area of decay that's very deep and close to the pulp, and how we determine if a tooth is going to need a root canal or not. I'm Dr. Brad Revering of Cross Timbers Dental, and I hope this video is helpful for you. So first of all, what is a root canal? Root canal is when we go inside of a tooth and kind of clean out the inside of the soft tissue, meaning there's the blood supply and the nerve inside the tooth, and we have to go inside and clean that out. You keep the tooth, you actually keep the roots, it's just that the inside of those roots is cleaned out. So what happens if someone comes in with deep decay? How do we know if they're going to need a root canal or not? Well, if they come in with pain and an infection, then quite obviously they're going to need a root canal if the decay is that deep, causing problems like that. However, sometimes when patients come in, we can see on the x-ray, or even visibly, that they have a very deep cavity, but they don't have any symptoms. Well, how do we know if that tooth is going to need a root canal? So what happens is the patient's tooth is going to get numb, so they don't feel a thing, and then we as the dentist will go in and remove the decay. And if the decay goes through the enamel, which is right here, and then continues through the dentin, which is the next layer in, and if it reaches this part of the tooth called the pulp, if it reaches that area, then that has to be cleaned out. And so that is the root canal process. So let's go through kind of the flow chart on how that would happen. We're going to ask ourselves a question during the middle of removing all of the decay, or I should say after we've removed all of the decay. Does the decay enter the pulp? If yes, then the tooth needs to have a root canal. That means we go in and clean out the soft tissue. When we go all the way down to these roots, all the way down to the very tip right here, we clean out all of this stuff inside of the tooth. Remember, you keep the roots, you keep the tooth, we're just cleaning out the inside of it. And then afterwards we fill up those tunnels, and then we put a crown on top of it. If, however, we're in there and the decay has been removed and it does not enter the pulp, but stops short of that, well, then you don't need a root canal. I'll say you don't need a root canal at that moment. You know, whenever decay gets really close to the nerve or close to the pulp and we remove it all, there's still a chance later that tooth could flare up or cause an infection, or we call necrosis, and cause a problem, in which case it might need a root canal. But when we do in those situations, we just remove the decay, we clean it up, seal it off very well, put a crown on top of it, and then most time patients are just fine with it. But every once in a while we'll have a patient whose nerve that just it was too far gone, and it was going to flare up later and end up needing a root canal. But that's kind of the flow chart that we follow here when we're trying to determine if someone needs a root canal when they have a very deep cavity. So hopefully this has been helpful, and I look forward to showing you guys more videos in the future. Take care.